Hi friend, this is Dr. Apul Mehra and let's talk about what we are getting in the 6th Conceptual Orthopedics PG course. It gets me nostalgia and emotions when I speak this word. 6th Conceptual Orthopedics PG course. The key point number 1 is outstanding, brilliant academicians. I think that is the key point number 1. Key point number 2, plethora of clinical cases. What are the clinical cases you will expect? Hip cases, which will be degenerative, non-traumatic, infective, spine deformities, infective, laxities and instabilities of the joints, pediatric cases covering the upper limb and the lower limb, basic sciences, there will be infections, malunions and non-unions. We also have other important deformities to take care of. Most important, this art and science of clinical examination would be taught by teachers who have up to 50 years of clinical experience and more and counting. We will have specialized sessions for your table vivas. And what we will have, we will be having the new thing that's coming up now, the OSCE session, both for MS and DNB. So see you on Friday, Saturday, Sunday, that is 1st, 2nd and 3rd August at Vidya, Jeevan, Greater Noida. Conceptual Orthopedic students, if there are subscribers, they just have to enroll and come. Remember, there is no fees for them because they are subscribers, but we are gifting them extensions in their subscription. See you on 1st August. Thank you very much.